the home remedy that doctors don't want you to know about. In this video, I'm going to teach you a powerful home remedy using ingredients you already have at home. You will drink 1 glass of this per day to treat herniated discs, headaches, and inflamed sciatic nerve. Countless herniated disc patients pay a lot of money to access this knowledge, and I'm going to give you these same tips for free in this video. But before revealing what is in this glass, I need to tell you about a decision that can change everything about your treatment. Do not get surgery. What the studies really show. Before talking about what you need to drink, let me talk to you about surgery. My first tip is, do not get surgery. Look at how a herniated disc behaves. Here we can see the disc nucleus shifting and compressing the nerves coming out of the spine. That is where the radiating pain with tingling comes from, as in the case of a herniated disc. Some studies show that in the vast majority of herniated disc cases, the disc returns to its original position after conservative treatment without the need for surgery. In the United Kingdom, this number reached 82%. That means that out of every 10 people with a herniated disc, 8 of them experienced spontaneous disc reabsorption. Why doctors get furious about this treatment? In the vast majority of cases, conservative treatment will be the best option. Some doctors get furious with me when I say this. Of course, some of them charge $50,000 for disc surgery, and I show my patients, and show here on YouTube, that it is possible to reverse this for much less without needing to enter a surgical center. But do you know what is the only situation in which I would actually recommend surgery? The answer will surprise you. The patient who lost movement in her feet. In all these years of my career, I have only had 1 patient I referred for herniated disc surgery because that patient was already at such a severe stage that the disc compression on the nerve caused the person to lose movement in her feet. This happened after a fall. It was traumatic, and the only solution was surgery to release that nerve so she could walk again. When conservative treatment works. Because the longer that nerve remained compressed, the harder it would be to restore leg movement. All other patients were treated conservatively. And if you have not lost leg movement and the symptoms are only pain and tingling, we can treat it conservatively in the overwhelming majority of cases. And the main cause of your herniated disc may lie in something you do, or rather, something you fail to do every day. 80% of your disc is made of this. The main cause of herniated discs and headaches is dehydration. The population is dehydrated. People are not drinking enough water, and this is why. About 80% of your spinal disc is water. These discs act as shock absorbers for your spinal vertebrae like water cushions, also ensuring congruence and smooth movement in everything you do with your spine. And for you to have a healthy spine, these discs need to be hydrated. And it is up to you to do that. What the MRI reveals about a damaged disc. Aqui nessa ressonância magnética, que é o exame que eu solicito para identificar as causas de uma dor lombar, a gente observa ali na flechinha vermelha uma hérnia de disco. Perceba que esse disco está escuro em relação aos outros. Isso significa que não tem líquido nesse disco, portanto ele está ressecado. Tudo que for líquido nesse padrão de ressonância, a gente observa na cor branca. Então, perceba como os discos acima estão brancos no seu interior, saudáveis, hidratados, enquanto aquele disco que está com a hérnia, ele está escuro, sem líquido, doente e ressecado. And what if I told you, there is a simple recipe with ingredients you already have at home that is capable of rehydrating your discs? That is coming right now. The Iranian doctor's discovery that changed everything. Mineralized water with whole salt is what you need to drink to hydrate your disc. It has been the cure for thousands of people around the world. Discovered by an Iranian doctor, water with whole salt deeply hydrates the cells, helping to replenish electrolytes and restore the hydroelectrolytic balance. This will also help rehydrate the discs of your spine. Why the pharmaceutical industry does not talk about this? Of course, they are made of cells. If you have tried everything but still live with body pain, fatigue, malaise, herniated discs, or migraines, Mineralized water helps reduce these problems caused by hyponatremia, which is intracellular dehydration. This simple water improves communication between our neurons and also reduces cramps and muscle pain. And the pharmaceutical industry does not talk about this. The public health system does not talk about it either. Health insurance plans say nothing about it. This is because it is an almost free remedy, just water and whole salt. But how do you prepare this mixture the right way so that it truly works? The preparation method makes all the difference. The exact recipe for mineralized water. Just 1 glass of 250 milliliters of water with a tiny pinch of whole salt. It cannot be refined, okay? It must be whole, coarse, pure salt. Mix it well and drink it in the morning on an empty stomach. This also helps with intestinal function, metabolism, and can help reduce hunger. Now, if your water comes from a clay filter, that is even better, because the tap water that the government fills with fluoride and chlorine is not going to do you any good. Hydration and movement, the combination that speeds up healing. And obviously, you will not drink only those 250 milliliters of water with whole salt per day. You need to drink 2.5 liters of water per day. But obviously, the 2.5 liters do not need to contain whole salt. Only that first glass that you drink on an empty stomach. When you combine this simple practice with aerobic exercise, especially cycling, you increase blood circulation around your disc. This also helps hydrate it faster. And if you are currently going through a flare-up of inflamed sciatica, there is a specific exercise that can relieve the pain in minutes, and I am going to show you right now. The first steps to relieve a sciatica flare-up. If you are watching this video during a flare-up of inflamed sciatica due to a herniated disc, I'm going to quickly show you a step-by-step exercise to help you improve these symptoms. Step 1. If your pain is intense, lie face down on a bed, mat, or exercise mat, on top of 1 or 2 stacked pillows, and stay in that position for 5 minutes. Step 2. If your pain is not intense, you can skip the first step and proceed to step 2. Simply extend your torso, resting on your elbows. At this point, it is expected that the radiating pain in the legs, calves, below the knees, and in the back will begin to decrease. How to progress with the exercise and see real results. Step 3. If the sciatic pain worsens, you must stop this exercise immediately. But if the pain does not worsen, you can progress by placing your hands at shoulder level and straightening your elbows, performing this movement, but without lifting your legs, hips, or pelvis off the ground. Do 5 to 20 repetitions every day. From the first week, results will begin to appear, but there is a very serious mistake that can make everything worse, and most people make this mistake without realizing it. The week-by-week progression of the exercise. From the first week, the exercise starts to become easier. The symptoms of sciatic pain, numbness, and tingling, all symptoms of the herniated disc, may begin to decrease in the legs. As this exercise becomes easier, you can raise your torso higher, but remember not to lift the pelvis off the ground. When you raise your torso even further, you will be able to progress with even more satisfying results. The forbidden movement that everyone does at the gym. Now be very careful because there are some things you cannot do in this exercise. What you cannot do is perform a push-up motion. That is not the goal here. On the contrary, you must form an arch with your back. Therefore, in this exercise, your spine must curve. It cannot stay straight. It needs to curve backward to better mobilize it, since the spinal cord runs through it. This is what will relieve the pain of the inflamed sciatic nerve. Another important point. You should never do trunk flexion if you have a herniated disc. If you do this trunk flexion exercise, you will worsen your herniated disc. I see it. It is a very common mistake I see in gyms, even among my own patients. Today I do not refer patients to the gym without writing a letter specifying which exercises are recommended and which are prohibited. And do you know exactly what happens inside your disc when you make this wrong movement? The explanation will make you never make this mistake again. Your disc is like a piece of chewing gum. understand the mechanics of pain. In the case of a herniated disc, trunk flexion is forbidden, and it is a mistake I see at gyms. Your disc is like a piece of chewing gum, hard on the outside and soft and gooey on the inside. Remember I told you that 80% is water and that water is in the inner region of the disc. When you squeeze a piece of chewing gum from the front, that liquid comes out from the back. When you make this movement with your spine, you are squeezing your disc from the front, meaning the hernia will be pushed even further backward. Therefore, if you have a herniated disc, or if you know someone who does and is doing this exercise, that lower back machine exercise, people at the gym think that just because the machine is called a lumbar machine, they have to use it to strengthen the lower back. If you have a herniated disc, do not do these exercises. I hope I have helped you with all of this and all these tips. More movement equals less pain.